8 symptoms women shouldn't ignore. Have you heard of the symptoms women shouldn't ignore in order to detect serious illnesses? While everyone gets sick, there are some diseases that only affect women. These diseases can significantly affect a woman's quality of life. Unfortunately, the most troubling thing is that many of these diseases harbor symptoms that are often confused with mild conditions. Because the symptoms go ignored, sometimes the diseases go diagnosed. This is why it's crucial to be aware of our health. Above all, we need to know how to recognize the symptoms that indicate a serious problem. In this article, we'll show you 8 symptoms that, in spite of being common, can warn us of something more serious. Discover them. 1. Inflamed limbs. Usually, the sudden limb inflammation is the main symptom of fluid retention or edema. While disorder can result from excessive salt consumption, it can also be a consequence of the following diseases: peripheral edema, nebasitis, arthritis and osteoarthritis, chronic kidney disease, liver cirrhosis, deep vein thrombosis, Achilles tendon rupture, sprain ankle cancer. 2. Abdominal pain. Abdominal pain is a symptom that can affect both men and women. However, it tends to be more frequent in women not only because of digestive issues, but also due to possible developments of complications such as ovarian cancer, endometriosis, pelvic inflammatory disease, premenstrual syndrome, ovarian cysts, myomas, celiac disease, irritable bowel syndrome, stomach ulcers. 3. Unusual bleeding. Unusual bleeding tends to be common among women with irregular hormonal activity. Sometimes, bleeding can occur outside of the menstruation period. In less cases, it can even occur after menopause. In any case, it's very important to be cautious of unusual bleeding because it can possibly be a result of cancer of the uterine lining, cervix or vagina, chronic vaginal infections, uterine fibroids and polyps, cervical mucus infections, trauma to the pelvic area, endometrial hyperplasia. 4. Lumps in the breast area. You should never, under any circumstance, ignore changes in the texture or shape of the breasts. While it's true that not all lumps or irregularities are linked to cancer, it's certainly one of the main symptoms of breast cancer. You should carry out regular self-checks, feeling for lumps covering the entire breast area to the armpit. If you do find something, especially if the skin is red or irritated, you should make an appointment with your doctor immediately. Migraines. Strong headaches, including migraines, can be a result of high levels of stress or certain nutritional deficiencies. For women, it's crucial to pay attention to them because their frequent occurrence can be a warning sign for conditions like the following: strokes, high blood pressure, heart attacks, blood clotting, digestive diseases, problems with vision. 6. Painful sex. Watch out. When sex is painful, something isn't right. Although these symptoms can be a consequence of a reduced libido, they almost always flag an illness or hormonal change. For example, Women who reach menopause usually experience pain during intercourse because the vagina produces less natural lubrication due to the lower levels of estrogen. Among other things, this symptom can also derive from ovarian cysts, vaginal infections, infections in the uterus or fallopian tubes, bladder inflammation, endometriosis, fibroids. 7. Chronic fatigue. Not surprisingly, chronic fatigue is one of the symptoms women shouldn't ignore. It can occur frequently with excessive physical activity or work. However, it almost always is a symptom of certain serious diseases. The risk of these diseases is why we should always be wary of chronic fatigue despite our familiarity with it. It could be a result of liver failure, kidney failure, anemia, cancer, cardiovascular diseases, thyroid diseases, sleep apnea, diabetes. 8. Unusual weight loss. Unusual weight loss happens over a short period of time, even in the case of following an unhealthy diet. In these cases, the patient notices a steady weight loss without trying to do anything to provoke it. Some might consider this symptom a miracle, but behind it can hide a serious illness. If unusual weight loss is also accompanied by a loss of appetite, it's a good idea to consider the following: celiac disease, diabetes, fluid retention, depression, digestive disease, cancer, thyroid diseases, cardiovascular problems, respiratory diseases. While these symptoms might not always reflect serious illnesses, remember that they should be receive the attention of a doctor. This is especially if there are significant risk factors or a family history. Don't leave it unchecked.